while I invite the panellists to come forward, I will share with you that Melanoma Patients Australia heard about the Smitty Fun Run at the PA Hospital, and that was hosted just recently, and we put the call out to our membership through our network to invite patients and family and supporters to come along. And the two people at the top of the list were Shannon from this morning and Pip. And when I went along on the day with my two young sons to support the run, it was very, very exciting to see that MPA won the team event in the under 40s section. And our name will live on in perpetuity. Thank you to Shannon and Pip on that trophy. So I think that deserves an acknowledgement too. And we just won't tell them that Pip runs marathons quite regularly or that Shannon raises money by running on a treadmill. Look, this session I'm really, really excited about, and I think that it is a credit to the organising committee to be putting such great emphasis on psychosocial issues when it comes to handling and managing and just the individual and the family and carer walking the journey of skin cancer, whether that's a melanoma, a basal cell or any other type of skin cancer. And so this aspect of the program today is inviting us to bring forward a panel of experts. And I call them experts because they have opinions and they're willing to voice them, and they have experience. and some of those experiences are both personal and also through their own skills education. And I will enable them to each introduce themselves as we go through the case studies, because I think we need to remove some formalities from the process here and get the discussion really happening. I am aware that we have gone over time a little bit, and so if any of you do need to leave during the discussion, please do so at your own leisure, but I strongly encourage you to stay and participate in this really wonderful discussion. So the way we are going to move forward today is to look at some patient studies and ask each of our members, Jenny Fox, Samantha Clutton, Sylvia Byrne and Julie Fraser, to comment on how they would address or deal with these issues that arise. So our first case study is a woman by the name of Ellen. Sorry, I just knocked that. So she's 57 years of age. She lives in Billawilla in central Queensland, and she's been diagnosed with multiple BCCs. She's divorced for a period of 4 years and lives alone with her 2 adult children living in Brisbane and one of them living in Billawilla with her. She has a close network of friends but does not like to complain or ask for help, and she works part-time and then looks after her grandchild 2 days a week. That does sound quite familiar to a lot of the patients I talk to. She has a history of depression with anxiety following her divorce, and she regularly travels to Brisbane for skin checks, and when she comes to Brisbane, she stays with a friend. So when she was diagnosed with basal cell carcinoma, it was on the tip of her nose, and she's had smaller multiple BCCs on her face, arms, neck, and has extensive sun damage. Her treatment has involved multiple previous surgeries on her nose, cheek and back, which has resulted in some disfigurement, and she's used Effidex cream, which had an inflammatory response, and she found left her feeling very uncomfortable and rather ugly. Her current treatment recommendation is more extensive surgery than she's previously had, and is recommended to have that in Brisbane with a plastic surgeon whom she doesn't know. So in presenting this, she's now called into the helpline and has spoken to Sylvia, whom I will invite to comment first.
Thank you, Tilly. So this lady, Ellen, is telling me a little about her situation, and I can tell as she's speaking that she's highly anxious. She tells me that she's living in central Queensland, so I know she's going to face the challenges of travelling to Brisbane for treatment, the inconvenience in some ways of staying with a friend when she's not sure exactly what her surgery is going to involve. Because Ellen becomes quite distressed as she's talking about the impact of this treatment and previous treatments that she's had on her face in particular, I feel it's really relevant to check in on just exactly how distressed she is. So we tend to ask callers to just give us a sense of how they're feeling at the moment and how they feel they're coping with the situation. And we just use a linear scale of 0 to 10. And So Ellen does tell me that she's way up there, around 7 and 8. So I know that she's quite distressed and overwhelmed by this situation. She's not really feeling that she's coping. And so I like to normalise that for her. I think a lot of the important work that we do in supporting people over the telephone and face-to-face is to help them realise that what they're going through is pretty normal for someone in that situation, and for Ellen, someone with that history. And I want to delve a little deeper into what she feels the main issues are for her, and to acknowledge that they really are challenging, and then to discuss some potential ways of helping her deal with those challenges. So I think Pip spoke earlier about how helpful it was for her to be involved in the decision-making process around her treatment for her melanoma. So that's something that I would discuss with Ellen, that if she's concerned, if there are other factors that are really impacting on her, it's important for her to say that out loud to this person that she'll be meeting, this doctor she doesn't really know. It's always a possibility to take things more slowly, or else to talk about why that isn't a possibility when you're facing treatment. I would then really talk to her about the support options that we have at Cancer Council Queensland. We have a whole range actually, and all of those services are free. I wanted to let her know that we do have other people who've gone through similar challenges to her, and there was one of our Cancer Connect program volunteers coming to mind for me as we were talking. So I advocated that it can be really helpful just to, again, normalise, but also have some hope around the fact that she could get through this treatment by speaking with one of our volunteers, and she was very happy to do that. So I said I would organise that process for her. But I also wanted to emphasise that she's quite distressed, and I feel that one of our psychologists in our cancer counselling service could help her develop some stronger coping strategies. And even though she's in Biloela, she'll be able to speak to one of our psychologists over the phone. And so again, Ellen was very keen to take up that option. And so I would then go ahead and organise those things, and first up have her speak to Julie, one of our Cancer Connect volunteers.
I guess my position would be, as a person who has had BCCs already removed and from my face, so I have an appreciation of the feelings that Ellen has about having surgery. In her case, she's been led to believe, because it's on the tip of her nose, it's going to require some extensive surgery, which will be disfiguring. So I would have to, first of all, acknowledge and make her realise that the fears and the anxieties she is feeling is quite normal, and she has every right to feel that way. I guess one of the things that goes against her is she lives in Biloela, but I really would encourage her to go and see her surgeon and talk to him about the anxiety she's got, and perhaps be reassured by him that the outcome might be better than she thinks. But I really think, as a patient, that is something we always should try to do, is to express our anxieties to the doctors so that they realise what the patient is going through. I also think that, particularly in women, we're good at guilt, and I think there is this guilt thing about sun cancer. We feel as though we're being punished for something we did years ago with all our sun baking. And I'd like to reassure her that this is something we all did. It's just that some of us are being punished more than others. And the fact that she has lived in Biloela or out Western Queensland probably all her life means that she really is much more liable to get it. And so, unfortunate, so that these feelings of guilt that perhaps that she deserves, that what she's getting is something that she shouldn't be feeling. I'd also encourage her to go slowly. BCC isn't something that necessarily has to be done tomorrow, to think about what her worries are, to set up a plan that she stays with someone in Brisbane, perhaps arrives a day earlier, gets comfortable, buys all the necessary dressings, ice packs, be knowledgeable about what she's going to look like afterwards. And probably with most of these surgeries you look pretty terrible, so she probably, particularly with bruising to the face, so she would probably want to stay a couple of days in Brisbane with her daughter, because that's when if there's bleeding going to happen or infection, she's in a good environment and close to the doctor. But most of all, her anxiety needs to be addressed. I'd actually ask her if she would like me to make a follow-up phone call, but most of all that she has been set up and she knows that she is going to see go and see someone at the cancer helpline, because that anxiety needs to be addressed and she needs to be able to feel that she's going to face up to this ordeal that is ahead of her, feeling the best way possible. And so, that goes on to that.
My name's Samantha Clutton and I'm a clinical psychologist, and I work at the Cancer Counselling Service, which is one of the services that's offered by the Cancer Council Queensland. And so referrals to us come via the helpline, so people are encouraged to self-refer or to recommend that their friends contact the Cancer Council helpline, and then they can ask for a referral, or the helpline, the person who answers their call on the helpline will provide them with that information if they feel that they're distressed or that they might benefit. So I guess importantly, we offer a service over the telephone, so you don't have to be able to attend a service face-to-face to obtain counselling from a qualified psychologist. We offer services that incur no out-of-pocket costs and up to 5 sessions normally, but we can extend that if it's needed. So I would set up the session as if we were speaking face-to-face, so I'd would make an appointment, would make sure she allowed an hour for me to then assess what was happening for her. So the first step would be just assessing the nature and the severity of, I guess, first of all getting a sense of the cancer and what's happening there, but also how she's feeling, the nature and severity of her anxiety, and what are the other things that are happening for her. It could be that her anxiety is to the extent that she's quite panicky and feeling that potentially she'll make a decision not to pursue treatment. And I think that does happen for people with very high levels of distress. Sometimes the only way they know how to cope with that is to avoid the trigger for that distress, which might be the doctors or the cancer treatment reminders. I then spend quite a bit of time assessing why is she feeling like this. Now, not everyone feels the same level of anxiety in response to the same situation, and her levels of anxiety are quite a bit higher than someone else in maybe a similar situation. So I'd really want to know what's happening for her. It could be the anticipation of leaving home, leaving her family, who perhaps, she might have a daughter who depends on her. It might be that she's afraid of, leaving her duties and responsibilities at home, but likely there's something else too. It might be that she's had past traumatic experience of treatment, or that there are other things happening in her environment, and this very normal and understandable anxiety is on top of those other things that might be happening for her. And we know that cancer never occurs in a vacuum. There's always other things that are happening for that person. So I'd spend a bit of time assessing that, and then really look at developing up a plan that's going to help her to manage her anxiety such that she feels in control again. And that might include things, and usually does, strategies to decrease her arousal. So coming up with some strategies to perhaps help her to decrease the levels of adrenaline that are circulating in her body, some relaxation strategies, for example. We might schedule some exercise. We might do some problem solving to address some of the problems that are contributing to her anxiety. We would certainly enlist the supports that she has in her environment perhaps do some work with one of her daughters as well to make sure that they are supporting each other the best way they can. I would most definitely look at what unhelpful or unrealistic thoughts even might be contributing to her anxiety and help her to sort of bring those out into the open and perhaps challenge those so that she's more able to see things more clearly, because when we know when we're anxious, we magnify the chances that terrible things are going to happen, and we engage in much more black and white thinking. It's either all good or it's all bad. So yeah, I'd engage in a variety of those strategies, and hopefully that would be enough to help her to feel more in control and more able to at least take that next step.
Excellent. Is there anyone else? I think we've definitely covered that one. Okay. So from that discussion, hopefully those of you here today, particularly with an interest in basal cell carcinoma or other types of skin cancer, can see the role that these services have in assisting the patient in their journey and understanding what is happening, and also then how to manage it moving forward. The next case study we're going to look at is a male by the name of Rob. Rob's 44 years of age. He lives in Brisbane and has been diagnosed with melanoma with a rapid progression. So he's married to Susie, who's aged 42, and they have 3 young children, aged 7, 9 and 12. He works full-time in a self-employed capacity with his plumbing company, which is his own business. He's paying off his mortgage, he has no income protection, and Susie stays at home with their children. So this is a very common scenario that we encounter through our organisation. He's been diagnosed with melanoma stage 2 on his left hip. He's had surgical treatment of the condition with removal of removal of the melanoma and a sentinel lymph node biopsy, which was positive, and he's been identified then as stage 3. He's at a follow-up 3 months later. His condition has now advanced to his liver and lungs, and he's been advised that he's now stage 4. So when Rob presents, when we're dealing with this issue of Rob, we're now looking at his wife Susie consulting Melanoma Patients Australia through a support group, and it's here that she meets Julie.
Well, when someone like this comes to a group, and it as Tilly says, it's often a partner coming on behalf of the patient. It's a very difficult situation to walk in on a group of people who know each other. So it's often a situation where I let them just sit for a while and get familiar with the conversation in the group, and then gradually we draw out their story. And it always surprises me. I'm merely a facilitator of a group, and the actual insight and the kindness and the sympathy, the empathy shown by other people in the group is often all that is required in this situation, where, because most of these people have been through a similar situation, maybe not as serious, not stage 4, but they've been through a diagnosis of melanoma, and all the dilemmas of how we're going to treat it, and particularly now there are even more dilemmas of how to be treated and what trials to go on. So it's really a night where we hope to allay some of her fears, or make her feel that actually there are other people feeling the same and have felt the same as she has and have the same worries that she has. Probably we might give some advice on treatment if in fact she's going on the wrong path altogether, or they are, you might steer them towards the melanoma clinic. So those sort of discussions do take place, but mostly it's all about how she's handling it and how the situation is going.
So Julie, if she's, I've noticed here, and in terms of she's come to you, she's started then articulating some of the matters that are arising in relation to Rob, and she's saying that Rob's refusing to acknowledge the likelihood that the cancer is not curable, has told his children and friends very little. Rob's cranky with the kids and with Susie, and the family's under huge financial stress following his extended time off work. And then there's increased relationship conflict, and Susie is experiencing intense sadness, anxiety, and an increasing sense of isolation. So as she's come to the group and identified those issues to you, further to what we've just said, what more would you suggest in the support group setting?
Well, in the support group setting, there's not a lot else we can do except that offer her support. And, I have it on occasions where that sort of thing has happened, where it is a carer, put them in contact with each other. So outside of the group, they have more contact with each other and they can share their own ideas. But the next step really is for her to ring the Cancer Council helpline, because she needs help, and she and her husband as a couple need help in sorting out their relationship difficulties at this time. Obviously very understandable because of the problems that they've got and the problems that he's not willing to deal with. So from the group situation, you would hope she does get some feeling of being supported by people who know what she's going through. But continuing on from that, I would really encourage her to ring the helpline, because I think she needs professional help. I would also offer to follow up with a phone call, which I usually do with patients like that, and again emphasise, have you rung that helpline, because things have to be put in place, definitely, which Jenny will talk about later, that need to happen, and until they start talking, then none of this can start. So I would go.
Thank you. So, of course, Susie calling the helpline would let me know, again, a lot of the background that's going on for her. And I would certainly acknowledge and let her know that often in these cases we do find that partners, spouses, carers, family members are often more highly distressed than the person who's maybe got the diagnosis and is facing this huge dilemma. I would acknowledge the challenges that she's facing and highlight the differences in the way people may choose to cope with such shattering news. That her husband Rob is coping quite differently from the way she is. She's the information finder. She's trying to drive the support for Rob, who is really turning away from that and not interested in talking about it. And many men will say, well, what's the use of talking? It's not going to change anything. I just need to stay busy and I need to stay positive. She has a lot of concerns around the children. So again, I'd be really saying, I want to get a clearer picture of how this is going for you and ask her to clarify her levels of distress. And again, with a situation like this, I can understand they're going to be quite high. And the suggestion I would make to Susie is that it would be very useful for her to, again, perhaps speak with one of our psychologists in our cancer counselling service. I'd explain that it's free. I would also explain that even though initially this support may be for her, that there is that possibility as she begins to perhaps find ways to handle the situation a little more differently in her discussions with Rob, that he may actually agree to come in with her, and that sort of couples support is available through our cancer counselling service. And so I think I would pass it on to you, Sam.
Thank you. So it's very common that we have partners of people with cancer who attend the cancer counselling service. In fact, nearly half of the people who attend our service are partners, and Sylvia's right, distress is often higher in partners than it is in the person themselves. But if possible and where possible, we always encourage the other person to come in for that session, because obviously you're going to be much more effective if you're dealing with a couple than dealing with one person who's concerned about how their other half is coping. Oftentimes we are successful in enlisting partners because the person who attends says that one of the things they know their partner is really worried about them. And so we say, well, why don't you encourage them to come in to look at ways they can support you? And then we can get them both in there together. So if I've got them both in the room together, I think first of all it would be just establishing how each of them are feeling and how each of them is coping. And it would become very clear, I think, that she's very distressed, and that one of the sources of her distress is she feels that he's not talking to her, he's not acknowledging perhaps the seriousness, or she feels like he's not acknowledging the seriousness of the situation, and she feels very isolated and alone and unable to deal and prepare and cope in the way that she feels she needs to. So we then talk to Rob, and it might be that Rob actually does acknowledge the seriousness of the situation, but he's just coping by trying to protect her. Oftentimes that is the case, by not worrying her, by not speaking negatively about the future. And so we'd establish very quickly that perhaps that's actually, strategy's not working for her, and it's not bringing them closer as a couple, and it's not helping them to deal with this as a team. And then we'd look at, well, what are the ways that you can support each other? And one of the things I think we often normally establish is that even the partner might not be speaking about it, but it's not that he doesn't care about his partner, it's often that he cares about, for example, his partner very much and is trying to protect and shield her. When he hears that one of the things she really wants him to do is to perhaps engage in some really serious talking and thinking and planning about the future, then he agrees, well, okay, well, what can I do? What is one of the things that I can do then for you, even if it's more for you than it is for me, to help you to feel better? And then we might agree that perhaps maybe making an appointment or talking to the GP about maybe speaking to someone about palliative care might be something that would make her feel a lot more in control, a lot more like they've been thinking about and planning for, all eventualities. So I'd be then referring to them back to their GP, perhaps to speak to someone like Jenny.
Thanks, Sam. So just looking at that then referral on to palliative care, I guess palliative care is all about focusing on helping people to live well, and at the most basic stage it helps to provide relief from the physical symptoms such as pain and nausea once they start occurring, but it also provides that psychosocial support. And a palliative care referral might involve linking in with a palliative care team, which can be made up of palliative care specialists, as in doctors with specialist palliative care training, or with other allied health professionals, so perhaps a social work, psychologist. So it's a full team approach to care, and it also involves not only the patient but the family members. And palliative care is provided on a needs basis. So, when you're given this diagnosis, stage 4 melanoma that's progressed and there's no more curative treatments available, that's when we talk about palliative treatments. And you can be having palliative chemotherapy, palliative radiotherapy, or, as Mark's mentioned today, even palliative surgery. So it's all about helping you relieve any symptoms that you might have and living life to the full and having those conversations about planning for the future. And I suppose in thinking about this case, I can identify with Susie here in that, I was in that same situation 8 years ago. My husband was diagnosed with melanoma, and 6 months after he was diagnosed, we were told, go home and get your affairs in order. There's nothing more we can do. It's only a matter of months. And, that was devastating news for my husband, for me and our family, in our mid-40s, to be told that. And I suppose at that time there were no treatments for melanoma apart from clinical trials. And so we sort of went through this process of looking at trials that we might be able to be involved in, because when you're at that stage of your life, you want to do everything you can to give it your best shot. And I guess those who are diagnosed with stage 4 melanoma today are in many ways in a much better position, because there are so many more treatments on offer. But at the same time, there's more choices to be made, more decisions to be made. And as a patient and a family, how do you make those decisions around whether to go on these trials or go on these new treatments? Weighing up possible side effects. And that's where if you're linked in with a palliative care team, they're a team of specialists who are there to help you through that decision-making process. And I guess, you know, if as you know, the disease progresses, as it does sadly in many cases, we know that the incidence rate of melanoma deaths from melanoma in Australia are around 1,500 every year. You know, people are going to progress through with more serious symptoms and require more care at home. And research shows that, you know, the majority of people diagnosed with cancer do want to remain at home for as long as possible, and in many cases their wish is to die at home. And it's through linking in with palliative care that you're able to do that. And in our case, that was exactly how it was. We were linked in with Karuna Hospice Services here in Brisbane, and you know, my husband got to the stage where he was in serious pain, and we had to have the hospice nurse come to our home every day. My husband was having morphine, and that needed to be restocked every day in the syringe driver that he had. And it was through linking in with palliative care that he was able to stay at home, and you know, it was his wish to remain at home until he died, and through the support from palliative care and the hospice service, he was able to die at home. So yeah, it's certainly not an easy journey, and you know, we all have this idea that palliative care is just about end-of-life care. Well, it is that, but it's a lot more than that. It's linking in early and having that support early on, and coming to understand that there are these people out there who can provide that support, that psychosocial support, that spiritual support in coming to that acceptance, I guess, that, you know, maybe as much as we want to survive, often it's not going to turn out that way. And by linking in with palliative care, this team of people who've had experience working with patients on that journey, there are a lot of benefits. And thinking back to my journey with my husband, you know, that was probably the best thing we did in the whole journey, was to link in with palliative care. And as tough as it was, and as, you know, I'll never forget the day that the palliative care nurse first came to our home. I thought, what are you doing here? We don't need palliative care. We're going to beat this. My husband's going to survive. But, you know, our GP had seen this before and knew that it was time to go on the syringe driver and prepare us for what was the outcome that we didn't want. But unfortunately, that's how it is for you know, 1,500 people with melanoma in Australia every year. So I guess for Susie and Rob in this case, I think, you know, they've gone on this journey, they've met with counsellors, had some support, and, you know, got to the stage where, you know, they've got to make decisions about the future. Where does Rob want to spend his final days? Is it at home? And if so, link in with a community palliative care team and have that support. If he makes the decision that he wants to go to hospital, many of our hospitals here have palliative care services. But the most important thing is to talk about it, have those conversations, and be prepared.
I think that's probably a wonderful point to leave it on, in terms of by having those conversations and being prepared. And that I think endorses what you're saying about early referral and access to these sorts of services, and also the importance as the continuation the journey continues, the role of people like Sam or like Sylvia, or indeed the MPA support group, continues, and that can continue well through the journey and beyond as well. And those services are available free and accessible to people. So I think that what we can take from today's discussion, and rather than sit here with a bunch of slides and things like that in terms of graphs and statistics, which this week has been touched upon in the main conference in terms of the role of support services and the distress that people can feel and the anxiety, and looking at the quality of life issues surrounding melanoma and skin cancer. I think the panel today have really epitomised for us through these two stories about the importance of normalising the experience emotionally for people, of seeking out peer-to-peer support, of seeking out professional support, to acknowledge the response of yourself or of the carer or of your family to a diagnosis of whatever that skin cancer may be. It's also been identified the importance of making an informed choice and seeking out accurate information, reliable information. You know, Libby spoke earlier about clinical trials and showed us where to go, and Mark really showed how you can get confused if you don't go to the right places as well. And that then can be complemented by the support services so that you have clarity of mind in understanding the emotional aspects of your condition. It's also really important, and I think Julie really touched on this very well in talking about the time, that patients want to feel in control of what is happening, and that sometimes you feel pressured to make decisions and that there is no time. And we do know that, particularly in the case of melanoma, things can progress if left too long. But at the same time, if you are feeling pressured and feeling hurried, and you're not then able to make an informed decision. And so it may just simply be reaching out and making a phone call, or taking that extra day or two and attending a group, or just going to the websites that have been shown. That may just enable you to buy some clarity of understanding, so that as you understand your disease and you understand your options, you ultimately are feeling empowered to make an informed choice. I think that's clearly what the ladies have epitomised today. Most importantly, and I think this is something that we as a group all collectively need to remember, is that cancer affects your sense of identity. And so what we commonly hear, and I know that the panellists have told me previously, is that people will come along and say, I am not my cancer. I am still the same person despite being diagnosed with a skin cancer. That my name is Shannon, and yes, I have a BCC, but I'm also a personal trainer, and I also have a lovely partner. Or my name's Pip, and you know what? Yes, I've had melanoma, but I love to run marathons and I'm bloody good at it. And that's what we want people to know, is that we are not our cancer, and our cancer does not define us or strip of us of our identity. And that is something for us to remember as a patient, but also to remember as someone working with people who may be dealing with a condition, is to treat them the same. And if you are concerned, or you identify that maybe they're feeling some of these emotions that we've identified today of depression, anxiety or distress, to perhaps refer them on. So I think that the panellists have been very good at demystifying these issues. I think Jenny has given us a wonderful demonstration of the role of palliative care in the transition from curative treatment of the options of clinical trials and looking at confronting mortality, which is a huge issue for some people when it comes to skin cancer, particularly in melanoma. And I think that the sensitivities surrounding that issue sometimes make it taboo. So we've touched upon it here today, but know that the information and services and support networks are out there for you. I think that Samantha and Sylvia have really wonderfully epitomised and embodied everything that the Cancer Council support services stand for, and the wonderful benefit you can get from their free services and resources. And our very own Julie definitely has highlighted again what Melanoma Patients Australia prides itself on, which is offering a community of support in a time of need, that it's driven by patients for patients, and provides you with a safe environment within which to articulate your concerns, feelings, and also ask those questions that perhaps you either don't get time with clinician or may not come to you at the time of consultation. Finally, I just wanted to say then that what we're talking about today is all about access and all about how to get help. And this here has been a really wonderful example of two fantastic organisations that exist: Melanoma Patients Australia and Cancer Council Queensland, and indeed Cancer Council across Australia in the various states and nationally. What I do think then is it's important that the people in this room no doubt have had some interaction with those organisations, because otherwise you wouldn't be here today. And if you haven't, I welcome you, and I'm really pleased you are here. But what it means then is that Today we are talking about these cancer support services, which are fantastic, and we all have now learnt about how we can benefit from them. But I put it upon you that we are now learning about self-advocacy and about being empowered ourselves. But take from here, if you are here, it arguably indicates to me that you have engaged at some level, because you're here. But I would put it to you that there are people out there who you are going to meet and interact with who haven't. And that is what today is about too, is not just empowering yourself and not just advocating for yourself, but joining in a voice to engage with those people who probably need it, who might be at home alone, who can't check the lesion on their back, or who can't do things for themselves because they haven't quite yet found out about it. And that's where organisations like ours come into play. So that's the conclusion of this session, and I would refer you to these cancer support services, and this actually then would conclude our session this afternoon and also the whole forum. So I would like to take the opportunity to commend the organising committee on putting together a phenomenal workshop for us as consumers. I don't know if we like that word, consumers. Ugly, I would say we're just people. And I think that one of my colleagues from down Melbourne indicated that he didn't choose to buy his cancer, so he refuses the word consumer. And I think that Paul was quite right in saying that, and I will borrow that today. But I think that what we have learnt today has touched upon the various spectrum of skin cancer, going from your basal cell, your squamous cell, indeed the Merkel that Pip touched upon, and melanoma, and realising that there's a great role to be played by early detection and prevention messages that are operated through organisations such as ours, and then moving into the treatment space and the role of clinical trials, which I see that Libby has held the fort and stayed, and we do commend her on that from our earlier session, and really understanding how to be empowered to access those things. And finally, our panel, I do again thank you. I think we should give them a round of applause. I just want to acknowledge the patients who are in the audience. I want to acknowledge those people who I know. We've got representatives here from Tasmania, Canberra, Melbourne, Victoria, north up to Gladstone. I also want to acknowledge those of you who have come who are affiliated with our organisations, but most importantly, I want to thank you, because this day has been all about you, and hopefully you've gained something from it. We're now going to depart from the formal proceedings and share a lunch, and realise that if you have questions, approach us. That's what we're here for today. If you have questions and seeking peer-to-peer support, look for these women, look for those around you and talk. If we get the conversation started, that's half of the issue addressed. Early detection, prevention, and supporting each other if the need arises. So thank you very much, and thank you again. Cheers.